Welcome to The Patient Physician, a space for doctors to explore their physical, mental, and financial wellness. Your peers and industry leaders will destigmatize institutional perceptions while redefining success, money, and personal care. Get ready to pull back the curtain because here, you are both patient and physician.
Welcome to The Patient Physician. My name is Paul Smith, and I am joined today by my co-host, Chris Fulbright. Chris, I didn't actually think that we were going to get this going because we just were having too much fun prior to setting it off. So I know we're both excited to visit with Dr. Georgeanne Freeman. She runs a family medicine wellness clinic here in the Austin area. She is in the downtown area specifically. Dr. Freeman, you go by the downtown doctor. Is that kind of your nickname? Is that fair to say?
That is fair to say. Technically, for tax purposes, it's Freeman Medical Clinic, but most people know us colloquially as the Downtown Doctor Clinic.
Well, we are not the IRS, so we'll refer to you however you want. Yeah. She is Texas born and bred. Dr. Freeman grew up in the Houston area, but spent most of her early days in her career practicing medicine in rural America, namely in the Appalachian Mountains and in the Ozark Mountains. On her way back to Texas, Dr. Freeman made a few stopovers in Portland, Oregon to complete her undergraduate degree, and then in Johnson City, Tennessee, where she completed a Master of Public Health degree at East Tennessee State University. Then she moved on to Des Moines to complete her doctorate in osteopathic at University of Osteopathic Medicine and Health Sciences. Next, she moved on to Kingsport, Tennessee for a rotating internship and finally finishing up her residency training at the University of Washington in Seattle. She is a board-certified family medicine physician, and Dr. Freeman has worked in emergency rooms, hospitals, and clinics. And we found out recently, even riding horses out to see patients. So you would be the first one that we've spoken to that has done such. But anyway, welcome to the show. We're glad to have you.
Thank you so much. I'm happy to be here.
The first surfing doctor who also has ridden horses with insulated saddlebags. That's right.
You didn't take the surfboard on the horse, though, right? I mean, that was a different event.
That I haven't done yet. So, let me know if I need to up my antes.
Even in the Appalachian Mountains, that would have been looked on differently. Yeah.
Well, as a country doctor, though, you learned a lot about medicine, making house calls like I just mentioned. Can you walk us through and paint a picture of what that looked like? Because I know we don't talk to a lot of people that had that kind of experience. So what was it like being a rural doc in the Appalachian area?
Yeah, so my vision, the reason I went to medical school is that I wanted to live in a bucolic, beautiful rural area, not have to be dependent on a man to make a living, have a career that would challenge me lifelong, that would be fun and fulfilling, and where I was really needed. And it was right when the National Health Service Corps was amping up and the federal government was putting a lot of money towards recruiting medical students and residents who would serve in these underserved rural areas. So it was a real hand in glove situation. The timing was right for me. I imagined a corncob pipe and a one-room cabin. I would live out my days and grow my vegetables, and that would be that. I never imagined I would be in an urban environment again, interestingly. So yeah, I went to medical school, got a beautiful partial scholarship from the federal government, and then served my 8 years in the rural Appalachians and rural Ozark Mountains and just loved it. It was a wonderful situation for a new family medicine grad because I was in these super remote areas and I got to be the specialist for everything. Like there wasn't a psychiatrist, there wasn't a pulmonologist, there wasn't a cardiologist. So I used all this great training to do all of those things. And so now one of many unique facets of my practice is that when you come to see us, I may refer you somewhere else. I'm not going to keep you if it's best that you go to a specialist, but I can handle a lot because family medicine doctors are really very well trained in a lot of disciplines. And a lot of people don't know that. So I'd like to just emphasize that.
Well, it kind of brings back the term general practitioner or GP. We don't usually do that anymore because we use the subspecialty, but really that's what you were doing.
Right. And unlike a GP who didn't do a residency program, I did a 4-year residency program. So it's like a GP, but more training.
Okay. Okay. Yeah.
Yeah.
I guess I meant it in the very general sense of you were practicing a broad scope of medicine.
Yes.
As you started in the rural environment, right? That's kind of a vision. One of the things that we talk to so many of our physicians about is, why did you get started in medicine? Like, what led you down that path? You talk about being in Houston, being obviously in a huge city, and then going rural. And as you look at your training, Tennessee, Des Moines, those were smaller. What led you to that path of going that route?
I really like small areas, and
Okay.
I'm a nature girl. I love to hike. I like to swim in clean lakes, and I grew up surfing in the ocean. It was more a lifestyle choice for me originally, and it
Okay.
just happened to be that, oh, and they really need doctors in these rural areas much more so than urban areas. So I was like, oh, great, let's go.
Yeah. I grew up in North Georgia, right? So the Appalachians were literally out our back door, and I spent a lot of time whitewater rafting and camping and hiking and different things in that area. When you go into a town like that, are you replacing someone? Are you coming into a family that someone who's been there for decades? Like, how do you get to meet people? I mean, obviously we kind of joke a little bit, but it was true. You know, literally you're on a horseback going to see people in the Ozarks and Appalachians. Is it a community doctor that you're going in to work with, or did you have to create that yourself?
That's a great question. So I didn't have to create anything. I never owned my own business in these rural areas. It was very much corporate hospital system owned, and
Okay.
they just couldn't really believe that someone who went to the University of Washington, the best family medicine program in the United States, wanted to go to these places. So at the outset, anyway, I was treated very, very well. And let's see, my first position, I don't know that they ever had a doctor in there. They had a nurse practitioner. So I wasn't replacing anyone there. My second position, I was replacing a man who was retiring. And it was wonderful because he really took me under his wing, introduced me to the patients, worked alongside me for a few months
Okay.
because he had been there for years. And then
Yeah.
he was able to kind of ease out. He was very concerned that the patients really were okay with this new was young back then,
Yeah.
whippersnapper doctor coming in.
Yeah.
Yeah.
Did you find that there was a transference of trust then? You know, growing up in the Southeast, I do know that the family doctor has such a high level of trust, and you get very accustomed to the way that they sit down with you and the time period that they're not running 35, 40 meetings a day. Like sometimes we talk to people in other urban areas. You almost expect them to be part of the family. You know them, they know your family and your kids. Did you find it was a temperament of treatment that you related to better, or now running this concierge practice in Austin, do you find there's this pool of number of people I need to see versus really getting to know the family and going a little bit deeper in that level of care?
I was treated so well by the community. It
Mm,
was shocking and sometimes a little embarrassing, like the way people would treat me at church, the gifts that people would give me, the deference. If I would go in, I'm a hardcore gardener, and people just, they in a small town, they know who you are, even if you've never met them.
yeah,
Going into the hardware store to get seeds, or if I needed anything, and people would come over and try to plow up my garden for me without me asking. And really just, I hadn't thought about that for a long time. It was wonderful. I loved
that's
it.
great.
I loved being treated
Southern
so.
hospitality. Whether you need help in your garden or not, we're going to show up and help you. You're like, well, no, I just planted that. That's next year's crop. That's great.
Yeah. And I would tell my husband, look, it may be Sunday, but we need to keep our clothes on in the yard because
That's
somebody
true.
by.
It's the small unwritten rules. That's right.
Did you find that being so well known, though, out in the community created an environment where you were kind of on call or needing to address or talk to people 24 hours a day, anytime that you were out? I don't know that people would normally do that, but in a small community like that, you might have those kind of conversations.
So at church, yes, people would, oh, can I just curbside, like I got this rash, and I never minded at all. But we lived on big acreage that was even more remote from where my work was. My husband and I I'm not married anymore, but so I should say my ex-husband, I guess. We hunted most of our own meat. We grew most of our own food. And we bought this huge piece of property that bordered the Conservation Corps for another several thousand acres. So we were really out there. So if you wanted to come by my place, you had to really make an effort.
By my place. Did you hear it? You're speaking my accent there.
I'll tell you, I've got some stories. I don't know if y'all are going to want to edit some of this out or not, but I think that my personality is also uniquely I love people. I love to meet people. I had moved several different times. I'm happy to reinvent myself. I think it's real fun. And we had some issues with neighbors. And when I say neighbors, remember our nearest neighbor was close to 5 miles away, and they were cooking meth. I found out later what that was all about. Now we have an understanding because we've seen TV shows and stuff. And
right.
Listen, these TV shows are spot on with a lot of what they're saying. And from northern Georgia, you know what I'm talking about. Sadly, I think the prettier an area is, at least in the United States, and the more affordable it is, the more you need to really look at your neighbors because they're probably cooking meth.
We had moonshine. I would run into people doing moonshine. At that point where I was going, I didn't bump into meth. I probably bumped into meth things and didn't know what it was back then, honestly. But yeah. I always just assumed we would, and it was always, you just back out of the area very quietly and don't put for the moonshine. Did you see that as well?
I didn't see the moonshine, but I'm related to some moonshiners up in the Ozarks in Arkansas. So
love it.
That wouldn't bother me none at all. I just.
That was your form of payment back then.
Sip and yeah. And good moonshine's hard to beat. Still,
it's a good barter system. It's true.
Well, so what stimulated the change that ultimately led you here to Austin and starting your own practice? If things were kind of the way that you wanted it, the living environment, the people, the social interaction, why the change?
So we've talked about the pretty, and now we're going to talk about the ugly.
The pretty, right? and now the dirty.
And now the dirty, but not the good dirty.
Mm-hmm.
Yeah. So what happened is, after a few years, and I'll tell you that I wasn't really aware in my prefrontal cortex what was going on, but my mother and my brother had an intervention. I'd say this would be about 4 years in to living in the Ozarks. My mom flew my brother in, he came to visit, and I just thought it was a visit. But I could tell he had something on his mind, and I asked him, and he said, well, we're concerned about you. And I said, concerned about me? Why? I'm living the life. I'm so happy. I'm doing everything I wanted to do. And he said, well, we think you're depressed. You've put on a whole lot of weight. And my brother's a winemaker in California. He said, and you're drinking a lot. And I said, I did like any human would do. And my amygdala got defensive and told him he was wrong. And we didn't have a very pleasant interaction. And then after he left, I started giving it some thought. Of course, I realized that he had some valid points and was probably right, and led to some soul searching. And by then I had been fired from 3 jobs. So yes, I was living in a beautiful area. I loved the people. I loved the medicine. I loved the community. But I had been lied to by my first 3 employers. So I got hired at a certain rate, and then there was something in the contract about, and if you're efficient, this is the bonus fee structure. Well, I was reaching the bonus fee structure because I've always been very time efficient, and they just weren't paying me. And so when I started asking about it, and when I was asking about it, I started off being real nice and sweet, like girls are, like we're all trained to do, even from Houston. And then I felt like I had to get louder and voice my concerns. Hired an attorney each time who assured me that I was interpreting the numbers correctly and that I was being taken advantage of. And then they would fire me and just go to the National Health Service Corps, which, as I mentioned before, the federal government was putting a lot of money into placing doctors. So it became apparent at some point that I was just a number. I definitely didn't matter to these hospital-owned organizations, and they could just churn and burn. They could fire me and bring somebody else in. Not a problem to them. Big problem to me. So I got married the weekend after I graduated from residency. So I was newly married, moved to the rural Ozark Mountains and started my first job as an attending. Then I get fired my first 3 positions. And my husband, after the third time, said, I don't know what's going on, why you can't keep a job. I'm going to guess it's your mouth. Why can't you just shut up and go along and try to keep a job? And I was like, oh, yeah, I don't know. I've always been mouthy. You're right. Always been mouthy. And I tried to be quiet. I tried to get along. But, in hindsight, it wasn't a matter of me getting along. I was simply speaking up for myself and my rights. But part of the problem with these rural areas, some rural areas, my experience certainly, is that they're very male dominated. It was all men in these administrative positions. They very much did the, don't you worry about those numbers, little lady thing on me.
Mm-hmm.
And part of me believed them. I was being gaslit, and part of me, because I am extroverted. I mean, as you can see, I express myself, and, not just rural cultures, but probably most cultures in the world, women aren't supposed to be that way. We're supposed to be quiet. But the more I did that, the fatter I got, the more I was drinking, the more miserable I was, really. So, long answer to, I had to leave. I couldn't stay there for my mental health. And my husband didn't want to leave. He was a good old country boy from Tennessee, and Lord, he was in his happy place for sure. But he agreed to move, and we spent a year traveling around looking at different places. And we ultimately chose Austin, Texas because, well, for a lot of reasons. I'm from Texas, and most of my family's still in Texas. So there's that. And then Austin satisfies the nature part of my soul. So yeah, we ended up in Austin, and I've been here 14 years. And it's a very different, so I'm going to answer your question. It's a very different situation, how I'm treated in the community, from your classic small town, rural America. And yet it's similar because I'm right in the middle of downtown Austin. I'm still the only family medicine doctor in downtown Austin, and I live a 5-minute walk away. So I live, work, and play down here, and I'm extroverted. And especially now that I'm divorced, I'm eat most of my meals out, and I swim at Barton Springs. I swim at Deep Eddy, and I really like cruising around. I don't ride my horse downtown, but I ride my bike. And I like it when people recognize me. It all feels very Fred Rogers, Mr. Rogers neighborhoody. Like there's the baker, there's the doctor, there's the dry cleaner, and I have my little niche, and I fit in, and so in that way it is kind of similar.
Yeah.
Did you realize that was the situation when your brother approached you? Sometimes we're aware of it and we're just in that denial stage, and then sometimes we were really not aware. It kind of, the way that you explained it, it feels like you really weren't aware.
I really wasn't aware. And I really wasn't aware, Paul, of the depths of my denial until I had been in Austin for several years, opened my own practice, and hired my first life coach. Who
we
held
just
up,
talked to somebody like that.
Exactly. That's what I was just thinking about. Yeah.
She held up a mirror and said, so, what about this and what about that? And I was like, oh, well, I hadn't really considered those things. And so I did keep piling on the weight, even though I made the move to Austin and I made some life changes. But yeah, it wasn't until a good life coach really dug in and I was like, oh, I'm just numbing out to my life.
Mm-hmm.
Because the human brain can compartmentalize all kinds of stuff.
Right.
And so I was compartmentalizing my career, compartmentalizing my married life, compartmentalizing, I don't know, the other stuff I do for fun, but it wasn't integrated. And I was definitely numbing out
Mm-hmm.
with food and alcohol.
Mm-hmm.
And
Such an easy thing to do, really, and then it just
so
grows.
easy.
Yeah.
Yes. Yeah. And I'm such a better doctor now because I have this compassion for my patients who are overweight, for my patients who overdrink or over anything. It may not have been my drug of choice, but if they're, doing porn to excess, if they're shopping to excess, if they're doing social media, anything that's not serving them and they're numbing out in those ways. Now I show up and I'm like, oh my God, totally. Do I know what that feeling is? I sure do.
Mm-hmm.
I know it firsthand and I have so much compassion for you and I've been there myself. Yeah. So I'm pretty open about it.
Leading by example, almost, knowing yourself in that way probably has made you a much better physician. But I'm willing to bet, based on the conversations we've had previously, that you were very good at compartmentalizing your personal life and still going and doing a great job and being a great physician to your patients. And they had no idea. It took somebody like your brother and your mother, people that actually knew you outside of that label to identify those things. Because physicians really, I mean, we're all very good at hiding things. I think you're trained early on. You just don't know it to kind of compartmentalize. Here's what I'm supposed to do. And here's how I'm supposed to behave. And this is the pedestal that all of society puts me on, and I really don't get to be real. So then we find ways to cope.
I agree with you completely.
So Dr. Freeman, based on how you were treated and those three employers as you started your career, what a difficult scenario that was. And you said y'all toured for about a year looking for another solution. Did you, during that year, is that when you said the best solution for me is to work for myself?
I was fantasizing about it, but I still had a year left on my commitment to the government. So when I came to Austin, I fulfilled that commitment working for Lone Star Circle of Care for a year. Okay. My human brain did what any human brain would do. And I said, oh, I don't know if I really want to open my own practice. I mean, nobody's really doing that. I could fail. Maybe I should just stay working for Lone Star Circle of Care, and I'm really needed. It's urban, but it's underserved area and Medicaid and all that. And then I got fired from that job. They let go a lot of people. That one didn't feel so personal. But when I got let go of that, I told my husband, because he was not supportive either of me opening my own practice. He thought that was a really dumb idea and I was sure to fail. And I said, well, darling, see, one of two things are going to happen. We're either going to borrow a shit ton of money and I am going to open my own practice because if nothing else, I've seen a lot of how it doesn't need to be and how it shouldn't be. Or, because he was a builder, I said, I can put on a tool belt and I come hang sheetrock with you all day. Because I've done all those odd jobs to put myself through school. And you can see me all day and all evening. And he said, maybe we should talk to some banks.
Well, darling, let's go visit a bank. Yeah.
I may know a banker or two.
Yeah.
Let's see what rates are looking. Well, you kind of flipped the end of the spectrum. You're working in public, low income household type service, where it's public sector, very direct, and for practices that you didn't enjoy working for, to then now not just working for yourself, but into a completely different type of model. I mean, you've been doing it for a while. There's not a lot still. There's a lot of private practitioners still out there, but not a lot that have switched to this concierge model. So that wasn't just a jump to work for yourself. It's another leap forward into the service model. So can you walk us through how you got from there?
Yeah. So there's nothing sudden about my movements. I may seem all kind of like I may make decisions quickly, but I'm a very methodical, typical doctor, long-term planner. And I accepted insurance, including Medicare and what's the veterans one? TRICARE. I did all that until 2 years ago. So I had my own practice, took all the insurances, was in all the payers until 2 years ago. And 2 years ago, I started suffering some burnout, not nearly as rough as it was in the transition from the Ozarks to moving back to Texas, but I had known burnout, and I had at least one life coach, as I will till I die. So I had more confidence in saying, well, I don't want to wait till I get to the bottom of some really bad place for my mental health. I'm going to go ahead and make a move now. And it was overdue leaving insurance. And I would like to say to your listeners out there, because I love that so many physicians listen to y'all, don't believe the hype. And I think that those of us who have stepped out of insurance really are pioneers, and this is how it's going to go down.
I believe that.
Yeah.
And I like to think of this man whose name I do not remember. He was a doctor in the 1800s in Philadelphia. He was a surgeon, and he noticed that when he washed his hands just with plain water, when he went from the morgue, because he was the coroner as well as the surgeon, when he rinsed his hands off and then went and did a surgery, it seemed statistically significant to him the number of times those patients didn't get sick or die. Mm-hmm. And he brings this up to his medical society, and the medical society is like, you are insane. This is heretical. And he was pretty much ran out of town. So I think anytime, it's kind of like the amygdala and the prefrontal cortex. Anytime there's a new movement in medicine, which moves at a glacial pace, it's seen as, it feels abrupt and it feels disruptive, and it is. But I like to think that we're just the pioneers, and we're going to save healthcare in the United States. And listen, it's not just the uber wealthy who come to see me. Our rates are affordable for a lot of people. A lot of our patients, while they're not Medicaid poverty, a lot of humans are figuring out that if they don't pay, let's be very conservative and say if they don't pay $200 a month to have health insurance, if they spend about that much money a month in a concierge model where they can be seen the same day and get this Dr. Peter Attia outlive medicine 3.0 level of care, they're going to be healthier health-wise, and they're going to be financially healthier, because if you put $200 a month into the stock market and that compounds at 7 to 10%, which is what we get now in the United States, you're just setting yourself up better in life. And most of us, if we do have health insurance, by the way, are paying $500 to $800 a month. Well, let's do the math on that per year. Let's do the math on that times 10 years, put that money in the stock market, or, God, don't let me say the word Bitcoin, or
don't
property.
say it.
Or, yeah, let's just not say that. But any kind of investment, well, you're really investing. And so let's just really take a look at this insurance industry, the whole industry. Do you want to put your money there? Because listen, we vote with our money.
Yeah.
And when I quit taking insurance, I'm going to go on a little bit of a rant here. When I quit taking insurance in my business, pretty quickly after that, it was time for me to re-up my personal health insurance plan. And I just wasn't doing it. I just wasn't doing it. Finally, I was like, you know why I'm not doing it? Because I don't want to.
Can I tell you, literally, before we got on this, I was talking to Chris. I'm like, I got to recenter my mind. And he's like, well, you sound a little stressed out. I'm like, literally was looking at redoing my health insurance. And as a business owner, I'm like, my God. Yeah. I think a lot of people don't understand that it's not that rates have been negotiated. It's that your employer is supplementing a lot of it in most cases. And then when you are the employer, you're going, I'm paying both sides of that. It's fucking expensive. It's crazy. And then you go, I don't do, am I going to try to risk it? Or, what do I do here? Because it just sometimes doesn't seem to make sense. And so I think, though, what you're talking about is not only being seen sooner, but really preventive medicine which is less expensive.
So I would like to know, if you're comfortable telling me, Paul, what are your thoughts? What are the thoughts in your brain that got you so worked up?
Well, just that it's so expensive. I'm looking at it, and it's anywhere from $1,500 to $2,000 a month.
Right.
I'm not trying to cover an entire tribe of people. It's three, one, two, three, all pretty healthy, all try to take care, but you feel like you're okay. I'm going to select probably the catastrophic plan. So that gives me a couple $100 extra. You don't really know what to do. So it's tough. It's tough.
You could pay a couple of $100 a month for each of the 3 employees to have a concierge doctor. Okay. Not do the catastrophic. Now can we talk about that for a moment?
We can talk about whatever you want. This is your time.
These insurance companies know what they're doing. They've got mathematicians, they got amortization tables. It's a whole industry. Okay. They know that the chances of any of your 3 employees, including yourself, of having something catastrophic happen is extremely low. They literally bet on that. The whole industry is predicated upon that. Now, let's say something bad happens. Let's say one of your employees gets in a horrible car accident. This is always where our amygdala goes when we're thinking about, but we have to have some kind of coverage. So let's just, shine the light under the beast under the bed. Oh, well, you get in that motor vehicle accident. You have a horrible brain injury. You're in the ICU. You rack up $1 million bill. This is why people buy insurance, right? To prepare for the potential worst.
1,000%.
Which it ain't going to happen. But let's say it did. So if it does, that person goes to the hospital. When they come to and they get discharged, that person has all the negotiating power with that hospital. They go to the billing department, and if they have insurance, we know what that looks like. The hospital's just trying to grab all this money. The patient is shocked at all the out-of-pocket expenses they actually had because they had insurance coverage, for crying out loud. But they have some huge bills still yet, right? So I argue that I'm in a better position because I would go to the billing department of that hospital and say, first of all, thank you so much for saving my life. What a team you have. I want to pay you for the great work that you did for me. Now I'm looking at these itemized bills and I see that it's $1 million. And you and I both know that you asked the insurance for $1 million, you're hoping to get 480, right? A little less than 50%. And I'm just throwing numbers out here. So let's say you're hoping to get 480. I can just flat out negotiate with them. And it's like any kind of negotiation. I can say, well, why don't you give me a number? Like if I wrote you a check and you don't have to go chase insurance to get money, what can you live with? And then we have a conversation and we go back and it's just numbers. And then they say, well, we'd be happy with $300,000. And I say, you know what? I think that's fair. I feel good about that. You saved my life. I was in here for a long time. There are a lot of tubes and stuff happening. And I'm willing to pay you that. Now, I don't want to write a check for that. I'm not going to say I can't write a check for that, but I'm not going to write a check for that. Let's talk about a payment plan. And we agree that I'm going to pay them $800 a month for X number of years. I feel really good about that because that's $800 a month I would have paid for health insurance. But now I'm actually paying someone who did save my life. And we could extrapolate this to be, I developed breast cancer and now I'm talking to my cancer doctor group. Like it could be the ICU, it could be the oncology group, it could be whatever. You just negotiate with them. That entity is going to be happy to be getting a check from you. And by the way, it is a federal law that protects people, meaning the first payment you make to a medical entity to pay off an agreed upon balance, that entity can never expect, if they cash the check, they can never expect or ask for a higher amount. So if we've agreed $800 and my first check to this hospital is for $800, well, they can ask, but it's illegal. They can't come after me, and I will not ever be forced to pay more than $800 a month because that was agreed upon. So you do want to have a little contract written up with the entity if you end up going that route. But just like anything else in life, it is negotiable.
Paul and I we were literally just talking about health insurance premiums, and we do financial work with clients on the side. And I can tell you, we have multiple clients that are ready to retire fiscally in their 50s, early 60s, and they are literally holding on and working and trading 30, 40, 50 hours of work because they're just terrified of health insurance and how much it would cost if they went on, but also this, what I think is, as you called, the monster under the bed of saying, what if this catastrophic thing did happen to me? It would derail my retirement. It would derail my legacy. I can't go bankrupt. So first of all, I appreciate you talking about this. Obviously, it's something I think would resonate with our listeners and us. Why is it that we're not taught this? Is it because of the machine of insurance and hospitals and stuff? Is that why?
I don't even really blame the insurance industry as much as I blame our lizard brains. Our amygdalae are just set up for disaster and live, and ask me how I know about it. She lives in fear. It's so easy. And it was so necessary when we were in the cave. And it's been necessary for millennia as we've evolved to search out the catastrophic, to look towards the negative. But it doesn't serve us anymore. And that's why I'm confident in saying this is the future of medicine. The future of medicine is telling the insurance companies to fuck off. And we do that by not buying insurance anymore. We do that by putting our money, we invest in small businesses like mine that pay fair living wages to our workers and have 1 to 2 hours to spend with our patients, and offer a Cleveland Clinic, Mayo Clinic level of annual preventive physical where we get to really know our patients. We can do preventive medicine. And then I would even argue that if someone is coming, because if someone's working at a job that they don't love anymore and they're just doing it so that they can keep having health insurance, what kind of a job is that? I'm guessing they're sedentary.
Most jobs are these days anyway.
Because most jobs are. They're not thrilled because what you're telling me is they're fiscally ready to retire. There might be some things that they would want to do for fun. What I didn't hear was, they still love their job. Don't get me wrong. Like, they still are super stoked to go to work most days. I didn't hear that because that would be a different conversation. And I think that's healthy and fine. But if you're waking up and you don't really want to go to this job and you're just doing it, then you're shackled by your own amygdala. You're letting fear drive literally the car that drives you to work. And then you're getting older, your muscles and your fascia and your tendons are less elastic. So you may want to take up sailing and go live on the Mediterranean Sea, but you're not doing that because you're going to this job every day. Well, that's not only decreasing your health.
Yeah.
You're holding on to an insurance that you're never going to need. And you're driving your health into the ground while you're doing it.
Yeah, I agree. I think so many times fear has become the overriding decision. But I think even as we work with people that are moving into retirement or changing jobs or what you've described, they're trying to get away from something more than going towards something or being pulled. And so that is a big one. You mentioned something that has resonated as Paul and I've done multiple of these now. Preventative care seems to be a frustration with many of the doctors that we visit with, that they're coming in after the fact. They're coming in after the cancer diagnosis. They're coming in after the weight gain. They're coming in after the depression. They're coming in after and there's things that are out there, as you're describing, the preventative portion they don't have time for, it's not paid for, or we even spoke with a physician who said, well, I mean, I'm doing that, but if I code it wrong, then it doesn't get paid or doesn't get approved or those different things. Do you have an opinion around the way that you set up your practice and the concierge services that you provide in the preventative side? And then I want to circle back on the life coaching, but on the preventative side, do you have an opinion around that?
Oh boy, do I have an opinion. And I just want to thank you two gentlemen for asking me my opinion and for inviting me on here. Like when you ask my opinion, I get these chills.
That's probably from Barton Creek.
I can see him from here.
That's still Barton Creek. Yeah.
It's the opposite of my experience, when I was told to shut up. So thank you for allowing me to speak and to have an opinion. Your other doctor was wrong. We were compensated very well by insurance companies for preventive medicine. A lot of people don't know this. So one of the success stories of the 90s was when insurance companies and physicians got together and they actually agreed that prevention saves the insurance company money. Okay, that's their language. They saw the statistics, they saw the math on that, and they said, yes, we would want to prevent things that we would have to pay for later that would be more expensive. And doctors said, oh, we're rejoicing too because we want to save our patients from, any morbidity or mortality that we can. So the diagnosis code has always been ZOO, and then it's ZOO.00 if there are no other problems that are found, or it's ZOO.01 if other problems are found. Very well reimbursed. And I'm talking about from TRICARE, from Medicare, from Aetna, from Blue Cross Blue Shield, across the board. I was paid well when I had a preventive visit with a patient. Interesting. Almost no one in my 15 years of taking insurance, whether it was in the rural Ozark Mountains or Lone Star Circle of Care or here in my own practice, very rare was the patient who would take us up on that. And guess what? Zero copay. So I loved doing the visit. I got paid well for it. The patient should love it. Zero copay even. But nobody took advantage of it. Nobody did it. Hardly anybody ever did it. So that is interesting to note. There's a lot of banging on, people can't afford, and we need to, no. It's actually been free for people with insurance for decades now, and people don't take advantage of it. In my practice, what I really enjoy about this population that is different from other populations I have served, so this answers an earlier question that you asked, is that it seems to be that for a lot of people, when they dial in the basics, like they have plenty of food, they have plenty of access to clean water, they have plenty of money in the bank, they have the luxury, and it is a luxury, to look at their mortality at maybe a younger age. And so these folks aren't in survival mode, and they come in and they've read Peter Attia's book, and they want medicine 3.0, and they want that annual visit. And sometimes they ask if they can do it every 6 months. And I'm like, heck yeah, you bet. Let's do it. They're doing their VO2 max. They're doing their bone density testing, their lean muscle mass testing, and all these things. And they really want longevity, and they want to feel as good as they can. And they do take advantage of the preventive medicine that we offer, but the majority of people don't.
So you're not taking any kind of insurances at all anymore. It's all just through subscription and membership. So does that mean the patients that you have are basically, unless you're sending them out, they're not really needing to have health insurance to a certain degree?
And most of our patients do have health insurance. And so if I order medication for them or I send them to a specialist, they can use their health insurance for things like that. I did negotiate a really wonderful contract during COVID with CPL, which is a local draw station group here in Austin, kind of like your LabCorp, your Quest throughout the United States. So we are a draw station here, not just for our patients, but for other patients with extremely low cash pricing. So that was great. But if they're getting a big battery of tests and they want to use their insurance, I can send them to another draw station and they can use their insurance for that. But yeah, we don't take any insurance at all whatsoever. I have 3 employees in my practice now. I went from a height of 14 employees. Now we have 3 and I'm one of them. And they don't have health insurance. And I explained to all of our members, you can have health insurance. Obviously, that's the norm. Most people still elect to have health insurance. But there is a movement, and every year, people will say around this time of year, hey, you talked to me last year and you were explaining like how I could probably have more money in my pocket for myself and my family if I invest in the stock market. I don't remember all those details. Could we talk about that again? And some people really are choosing to not have health insurance. And I tell them it's like anything else. You can step away from it. You can always go back to it. Mm-hmm. If you want to. Nobody does, but
if somebody has like an HSA, can they pay you through their HSA as well?
Many of our patients pay their monthly membership fees with their HSA. And while we are a membership, we will see people who aren't members, but they pay a much higher price per office visit.
Yeah.
Yeah.
So with some concierge services and practices, you're setting a limit of patients that you're going to have, subscribers or members, if you will. So have you determined what that was? You had 14, now you're down to 3. Did you have to shave some of the patient? Can you walk us through some of those numbers and how that's evolved?
Yes. So COVID really helped propel me to make a lot of changes because when you're facing potential death, remember, we're all like, are we all going to die?
Maybe.
Did you never have that thought during COVID that you might just die?
No, are you kidding? It's like a thought every day. I'm thinking.
Paul still thinks about that every day. That's.
I haven't been outside. This is actually 6 years.
This is free counseling for Paul. Is the whole reason of this podcast is just so we can bring really smart people in to talk Paul. So yeah, this is part of your life coaching, telemed. It's all rolled into one for Paul right now. Yeah,
I love it. Well, you sure look healthy for a guy who never sees the sun.
It's AI.
Yeah, my amygdala just got freed up to like, okay, worst case scenario. So we might as well make some big changes. So I dumped the husband and
before the insurance or after?
That was before. But that was the big change. And once I did that, I was like, oh my gosh, what else can I just let go of? And to be clear, I married a very nice man. I don't have one day of regret. Our marriage day was the happiest day of my life. I don't regret any of it, but I also don't regret divorcing. And so just set that for the record. Yeah. So once I just wasn't afraid so much, because if we're going to die anyway, I was like, well, I might as well let go of insurance. And it's been great. It's been so great. I work about half as much as I worked before. I make almost twice as much money. And I could retire. I'm 59. Let's say that out loud. But
you already said Bitcoin. You might as well. Yeah, you already said Bitcoin. Let's just.
Where else do we go from there?
I love coming to work every day.
That's great.
It brings me so much joy.
Were the number of employees you had because of the processing of insurance and stuff?
Oh yeah.
Or was it? Yeah. So you were carrying overhead that wasn't translating to profit for you. It was literally just moving papers to get reimbursed and fighting that. Interesting.
Yeah. And I had other providers working here as well. And we had to see 20 to 30 patients a day each.
Yeah.
To just keep it running. So of course I was numbing out at night and on the weekends.
Yeah.
So
yeah,
hot.
Just running full speed all the time.
Mm-hmm.
Paul and I were just meeting with a physician, and the recommendation is always more, right? See more people, bring in more people, more staff. And I was kind of talking to somebody, you've probably seen this or heard the analogy before about the New York businessman shows up in Mexico with the fisherman. Have you heard this analogy?
Oh.
And so the businessman flies in from New York, put whatever state, I don't know if anybody, comes into Mexico, right, to go fishing with his buddy, and starts talking to this fisherman. And he's like, so tell me about what do you do? And the guy says, well, I get up early in the morning. I fish until about 10:30 or 11. I catch enough fish for the day for my family. I get back. We we have lunch and the afternoon together with my family, and we drink some great wine at night. And then the next day I get up and I go fishing and stuff. And the businessman, of course, said, well, if you would hire more people, then you could catch more fish, and then you could make all this money. You could do this. And then once you scale this up, you could sell the business. And then the fisherman said, well, what would you do then? And he goes, well, then I would spend time with my family over lunch. We'd have great wine. And the guy, so it's this perpetual like treadmill of someone else's vision of what we should be doing. And the answer is not always more. The answer is not always, well, you've got extra rooms in your office, Dr. Freeman. You should obviously put more providers in there. And you actually have staff, and so you could have more staff. So sometimes that's the right answer. Sometimes it is. But, as a lot of entrepreneurs, that's not why we started the business, right? We started the business to do what you described, to not be running full bore 7 days a week, literally to move paper. So
yeah, that's exactly right. And it's refreshing to hear you say that. I've never heard anyone actually say that out loud, but those are the thoughts that I tell myself when I look around at empty exam rooms, and I start to kind of wring my hands, and I go, well, but I mean, I swim at Barton Springs or Deep Eddy every morning.
Yep.
I'm in the office 3 days a week. I take summers off, and I live on sailboats where I'm naked half the time.
Oh, in Lake Austin?
No, not exactly.
Okay. It's the Mediterranean of Central Texas. Yeah, that's good.
Sure.
So you have evolved even into additional services outside of just family medicine. You're doing the health, the wellness, but you're just doing some cosmetic services, and it looks like you're expanding on those things that you're providing to the patients that you have. So can you walk us through how you started to branch out? It seems like you're doing more for less people, but I don't know what your thought process was on adding some of these additional things for them.
So all the extra services that I do, I've been doing for decades. When I was in the Ozarks, I had some female patients who begged me to go get trained on how to do Botox. I mean, this is years ago. I know everybody does Botox now, but especially in the rural areas, nobody was offering Botox. And I was very young. So personally, I wasn't interested in it and didn't give a fig about it. So I did go and get trained because I had patients ask me. Same thing for menopause and hormones. When I was like 30, I went and got trained up on that because I had these women in menopause beg me to go get trained on it and be able to come back and prescribe hormones, because they maybe didn't have a provider offering those services, but they have TV. They watch Oprah. And they're like, well, on Oprah, Suzanne Summers is talking about all these bioidentical hormones and how we don't have to get dry vaginas. I told you I get dry vagina in there.
There you go.
That's right.
And we don't have to suffer with low libido and, all the horrible things that can happen with menopause. So I got trained up on that years ago back in the Ozarks. I brought those things in. So that stuff has come with me. The one thing that I offer now, the two things that I offer now that are new is one, this Ozempic. And I'm sure y'all have talked about the GLP-1s. The GLP-1s are nothing short of miracles. And we do offer that here at my practice for weight management and to decrease the craving for alcohol, because it turns out that those two things occur in the same little area of the brain. And then the life coaching. So I have a physician assistant. He's one of our 3 employees, and he sees most of the family medicine in the clinic. I'm here available for backup for him, for sure. But most of what I do, I'm the only injector, so I do all the Botox and filler, and I do the life coaching.
So not only did you find that life coaching helped you, now you're essentially repaying the favor and helping other people with, but just through your patient base.
And not just through my patient base. I do life coaching as another business as well. And that's really fun because I literally, as long as I have Starlink, I can be in a bikini on a sailboat. And yes, I take my summers off, meaning I exit the heat. I don't feel so good in the heat of the Texas summers, but I still work when I'm out there. And I love doing Zoom calls with my coaching clients because most of them are women my age and older. And I just show them, like, this is one option. I'm on a boat, I'm working, and I'm in a bikini every day. So let's go.
So let's go. Yeah. Did you have pushback from anyone about that vision? Meaning you're just not going to be in the physical office, but you can, obviously with technology, and we're all meeting via Zoom, right? Telemedicine's opened up this world to you where you can now literally be in Greece and still impact people in a positive manner. Did you get any pushback from people saying, hey, that model's not going to work?
I love technology, and I've always been an early adopter of it. I've actually been offering technology in my practice since 2009.
Oh, wow.
When COVID came, it just opened my patients up more to the concept and take advantage of it, but I was already offering it. The pushback that I mostly have gotten when I've changed iterations has been my own brain. I had a lot of guilt. Well, I went into medicine to serve the underserved. Who am I? What a traitor I am if I only help rich people. Had a lot of thoughts in my brain, a lot of pushback from myself, that my life coach helped me to understand that I truly do believe that everyone deserves good health care, and that in an urban area, we have wonderful options here in Travis County in Austin, Texas. People can go to community healthcare clinics. They can go to clinics that are subtended by state and federal funds. That's how they pay their bills. So it's not like the down and out are suffering and not getting healthcare because Georgeanne Freeman has decided to go concierge. But that took a long time to get to. There are members of my family. I will say my mother, I know, not directly, but through other family members, that she thinks it's weird. And there are some people in my family who don't understand how it is that I go live on sailboats, and I seem to be taking off a lot of time. And there's some man behind this. Does she have some Onassis funding all this stuff? And, just kind of typical tribal amygdala stuff that is hurtful. And I acknowledge that it is hurtful to me, but I ain't changing. I ain't going back. That genie is out the bottle.
Yeah.
On this pursuit to better take care of yourself, you're going to end up better taking care of all the patients you serve. So where to now? Where do you go from here?
It's a good question. So for the last solid year, probably a little bit more than a year, I've let myself calm down from trying to be that New York businessman to really just accepting that I am the fisherman, and really just loving the life I have without having a particular goal. I'm just really enjoying life right now.
Well, it sounds like from the way that you have evolved in your personal life, the more that you're able to do that, you've taken not only your experiences in the tough times, but now in these good times, hopefully you're able to translate that over better to the patients as well. You know, the name of our show is The Patient Physician. And so our final question really to you, and I appreciate your time. What does that mean to you?
What I love about the shows that I've listened to that y'all have done is how safe you make us feel, how safe you've made me feel today to be my authentic self and to share my story that is continuing to evolve. And I think that the more physicians share their story, there will be less suicides, there will be less burnout. And I hope to see a day when we get our power back away from these insurance companies, away from the shackles of our own fear that make us think we have to work inside of some kind of a system. We really don't have to.
Dr. Georgeanne Freeman, thank you so much for your time. I have really enjoyed the thoughtfulness, the sharing, the depth of the personal sharing that you were willing to do. And I love it. I hope that as you said, people out there that are listening, other physicians that might be going through or will go through similar struggles can listen and learn from this. And thank you so much for sharing your story today.
Thank you, Dr. Freeman. I also, I think of our physicians, they're up at 3 a.m. and they're walking through a parking garage. They're listening to the podcast. I would invite them to have the courage that you had to hire a life coach or hire someone to get out of the box and then think differently. Even if they're calling, I don't know, Dr. Freeman, if you meet with other physicians, but your courage of transparency of your life events. And so I want to thank you for that. As a fellow enjoyer of spending too much time in the Caribbean on sailboats, if we combined forces, we could get a bigger sailboat and probably stay for longer. So let's just leave that open. I'm not saying we need to. So love it.
Let's keep talking about that. Yeah.
Yeah. Thank you so much. We really appreciate your time. And I know this will make a huge impact.
Thanks, guys. Appreciate y'all too.
This conversation was brought to you by Physicians Resource Services, a firm supporting medical professionals to improve their financial situation and pursue their personal and professional goals. The Patient Physician is produced in Austin, Texas. Editing and sound design are in the hands of the PodConnects podcast network. Please email questions or show ideas to info@physiciansrs.com.